Welcome to Capital Connections. I'm your host, John O'Connor. We're coming to you from the H. Raymond Danforth Library on the campus of New England College. Did you know opioid-related emergency department visits in New York increased 73% from 2010 to 2014? For the next 3 weeks, we'll continue our focus on our attention of the opioid crisis and mental illness in Vermont, New Hampshire, and northern New York. Our mental health can be compromised by so many things, like sudden loss, complex trauma, chronic illness, co-occurring disorders, and more. Without proper diagnosis and treatment, people often self-medicate and begin a dangerous cycle that adds more challenges to their lives and the lives of others. Recently, New England College hosted a panel on mental health and the opioid crisis at their Concord, New Hampshire Center. The panelists included John Broderick, the former Chief Justice of the New Hampshire Supreme Court, Dr. Paul Dan, Program Director of the New England College Master's Degree Program in Clinical Mental Health Counseling, and the Executive Director of NFI North, a multi-service behavioral health organization. Peter Evers, the CEO of Riverbend Community Health Center, and attorney Michelle Merritt, Policy Director of New Futures, an organization that works to prevent and reduce substance abuse problems. The panel was moderated by Scott Spradling, an Emmy Award-winning media leader and consultant. We'll hear from Peter, Paul, and Michelle about their organizations and their efforts to address the related problems of mental illness and addiction. But first, these words from the good businesses that believe a well-informed community is the greatest strength in sustaining a strong democracy. Welcome back to Capital Connections. For the next 3 weeks, we'll continue our look at the opioid crisis in Vermont, New Hampshire, and northern New York, and the related mental health issues. Today, Peter Evers, Paul Dan, and Michelle Merritt will introduce us to their organizations and their efforts to help alleviate the problems related to mental illness and addictions. Let's join Scott Spradling, who moderated this panel discussion.
I would be remiss in working with John and with Peter on this Change Direction campaign if I didn't at least take a moment or two just to sort of connect the dots for you about why we've got these universes colliding together in some pretty fantastic ways. First and foremost, this awareness campaign called Change Direction has one singular and, I believe, simple goal. And John was talking a lot about changing that stigma and lowering these barriers so that people are talking about this, so that we're treating it like the disease that it is, the way we treat other diseases. So you've seen the palm cards that John was holding up. There are 5 signs. Our goal is to make those 5 signs a part of the everyday vernacular of life so that all of us as sisters and brothers, as parents, as children, as friends, neighbors, and coworkers know these 5 signs intimately, can spot them in those we know in our world, and can help those folks move towards treatment and therefore some help. The 5 signs are simply this: personality change. You may notice sudden or gradual changes in the way someone typically behaves. He or she may behave in ways that don't seem to fit that person's values, or the person may just seem different. Agitated. They seem uncharacteristically angry, anxious, agitated, or moody. You may notice the person has more frequent problems controlling his or her temper and seems irritable, unable to calm down. People in more extreme situations of this kind may be unable to sleep or explode in anger at a seemingly minor problem. Withdrawal. They withdraw or isolate themselves from other people. They used to be socially engaged, but now they pull away. Not to be confused with an introvert, this is a change in someone's habits and activities that you've known all along. Poor self-care. They stop taking care of themselves and engage in risky behavior. Maybe they let their personal hygiene deteriorate, or the person begins using more alcohol or other substances, or they start engaging in self-destructive behavior. And finally, hopelessness. They seem overcome with hopelessness and overwhelmed by their life's circumstances. Have you noticed someone who used to be optimistic and now can't find a single thing to be hopeful about? These are signs that, look, we're all human. We've all had rough days. We've had a rough stretch, a rough week. We've had life circumstances that have knocked us back. This is different. This is a change that becomes a more regular part of one's behavior. We feel and we believe that by raising awareness around this effort, by helping people understand these signs and learning to better spot them in others, we know what's going to happen, and it's the whole reason why we have this group here tonight. We believe by lowering the stigma, by launching this conversation, and by making a difference in families' lives, more people are going to need and seek some form of treatment, some form of help. So the natural question ends up being, is our pipeline wide enough to be able to handle something like that? Well, if the stats are 1 in every 5 Americans has some type of a treatable mental health disorder, 1 in 5, I'm going to guess we probably don't have a pipeline nearly wide enough here in New Hampshire or around the country. So it also means we have to do something about it. I'm excited to be able to say that with our friends of New England College, we're beginning to build that wider pipeline, and that's one of the things that we're going to talk about tonight. So let me take a moment and introduce our guest panelists. You've already heard from John Broderick, former New Hampshire Chief Justice and co-chair of Change Direction. The other co-chair of Change Direction, he's the president and CEO of Riverbend Community Mental Health. That's Peter Evers on the end. You heard from Paul Dan, who welcomed us from New England College's master's degree in clinical mental health counseling, which we'll talk about tonight, and Michelle Merritt, who is the policy director at New Futures. This is an all-star team of folks that are really working and starting to really work aggressively together to try to figure out how we can create that patchwork of a pipeline to help those who need help. So I'm glad you're all here. And let me start with a question. Peter, I'll go to you first. Make sure you speak loudly because I'm not sure what these mics are going to pick up and what they're not going to pick up. And I'm going to turn them on. How's that?
Hi, can you hear me, everybody?
There we go.
Okay.
So Peter, whose accent gives him away, yes, he's from Georgia. Peter? Georgia. Let's start with a very broad question of what is the most urgent message that you would want shared with these members here tonight?
Yeah, thank you. And thank you so much for coming, everybody. And once again, thank you, Justice Broderick, for bringing a voice and a face to something which has been in the shadows for so long. When you asked that question, there are so many things that I was thinking of as you were talking about that. And connecting the dots really is a perfect sentiment for how behavioral health disorders are connected to society, they're connected to politics, they're connected to individual suffering, and they're connected to a community's need to pull together and find a solution. I think the most important thing that I say, I'll illustrate with a story. We were interviewing the other day for a system of care coordinator for a substance use disorder person, and it was sort of a position that you need to be very outward with. And one of the candidates came in, and the first question I ask is this. I say, well, do you think addiction is a choice, or do you think it's a disease? So that was my first question. This person said, oh, it's clearly a choice. So then I had 45 minutes that I had to waste.
To be polite.
To be polite and get through the interviewing process. Wrong answer. If you believe that, then you haven't been paying attention to the research and the work that goes on that recognizes behavioral health disorders, mental illness, and substance use addiction as an illness, as a chronic illness that has, by the way, some of the most amazing outcomes when prevention, treatment, and recovery work together. In fact, the CDC will tell you that sustained recovery in behavioral health is better than outcomes for cardiac cath surgery, diabetes, and chronic heart failure. So why are we ignoring it? We need to begin to talk about it in terms of a disease that is treatable and has amazing recovery rates. And we begin to do that, we lose all sight of individual choice, and we talk about this thing as a disease.
Thank you, Peter. That's great.
Thanks to Peter and the Riverbend Community Mental Health Center. If you're interested in their work or would like to access their services, why don't you go to their website, riverbendcmhc.org, for more information. When we come back, Paul Dan, the program director of New England College's master's degree in clinical mental health counseling, will tell us more about what they're doing to train individuals in this caring profession. Please stay with us on Capital Connections. Welcome back to Capital Connections. I'm your host, John O'Connor. Coming up next is Paul Dan, the program director of New England College's master's degree in clinical mental health counseling. Let's again join moderator Scott Spradling.
Paul Dan, what is the message that you believe that this crowd needs to know from New England College, from your experience, and what you're trying to do to widen that pipeline?
Thanks, Scott, and thanks again, everybody, for being here this evening. Justice Broderick, for your comments. The most important thing, how much time do I have? Because, how do I put this so succinctly that you're going to connect with it and you're going to understand what the most important thing is? Because there's a whole litany of things that are connected together that have to do with what becomes the most important thing. I think one of the things that's critically important is what we're doing right at this moment. Do me a favor and just look around. Go ahead. Don't look at me. Look at each other. Look. We're coming together and we're working at talking and learning about how to address these issues. The most important thing is that we start to open space and have dialogue, combined with flexing. Once we've learned what's happening, becoming flexible and flexing out our systems. We have systems that live in silos. We have systems that have cultural overlays that lead us down paths that cause nothing but confusion, harm, and lack of outcome. So we've got to be in a situation where we're talking together, where we're opening the dialogue, and we're starting to flex out, based on that conversation, what it is we need to do. Peter and I had a conversation. We said, look, we need clinicians. We need mental health practitioners. There's no one here. What can we do? And together with New England College and Riverbend, we said, we can do some creative things in order to develop and advance our ability to have clinicians come into the field and come into helping people. So that's one of the things that we need to do, is starting to have these conversations. Now, you told a story. I'm going to tell a story. I was telling Tom out here in the audience, I've spent a lot of time at the doctor's office lately. That's not the important thing. Well, it's important to me. But I was at the doctor's, and the person was saying, well, where are you going? What are you doing? And I was explaining where I was going tonight. This is a lab tech, just, talking to me doing what she's supposed to do. And I told her that I was coming here because we're opening a dialogue around the connection between mental health, issues of complex trauma, and how that informs the challenges that we have now with substance abuse in our culture. And that how these things sort of live in a silo, and how we're trying to open the dialogue and bring them together. And the most amazing thing happened. She stopped and she said, I probably shouldn't say this to you, because she's a practitioner. There's rules about practitioners, what they can talk about, right? And she started to cry. And she said, my mother is having these challenges, that she's addicted now, and she had issues with her mental health, and now she's substance abuse addicted, and we don't know what to do. So for me to go back, not to take up the whole hour and a half, but to go back with this one critical question, to summarize, we've got to open the dialogue, and then based on what we know, through our dialogical exchange, we've got to come to better knowing and start to flex the system out so we can make the kinds of changes that John talked about, where we were and where we are now and all these other issues. We need to do it ourselves here for this issue. Thanks, Scott.
Perfect. Thank you, Paul.
If you have an interest in becoming a health counseling professional, you can get more information on the New England College program by going to their website, nec.edu, and click on Academics, then Graduate Programs. When we return, Michelle Merritt of New Futures will tell us about some of the legislative challenges and bringing about changes to make it easier to address mental health and addiction problems in our states. Please stay with us on Capital Connections. Welcome back to Capital Connections. I'm your host, John O'Connor. Over the course of the next 4 weeks, we're looking at the opioid crisis. Today, we're focusing on the obstacles before our states in providing good mental health and addiction services. Next, we're going to hear from Michelle Merritt of New Futures. She'll tell us about some of the legislative challenges and bringing about changes to make it easier to address mental health and addiction problems in our states. Now, let's join the moderator, Scott Spradling.
Michelle Merritt of New Futures, share with us your message of urgency to the crowd.
So I'm going to feed off the theme, I think, of being open and sharing your stories. As the policy director at New Futures, I spend about half my time working in the state legislature. I work on access to treatment issues for individuals with behavioral health issues, so substance use disorder and mental illness specifically. And I'll tell you, when I entered into this profession and I sat at my first meeting, I had a full appreciation for the value of people's stories. And I think that sometimes gets lost, that every person, if you show up to a legislative hearing and share your experience, legislators will listen. And so we can say that we want to do increased access to treatment, that we want to build up our workforce, that we want to fully fund our state alcohol fund. And people like me, I mean, we can only say so much. We're the same faces that show up time and time again. But if you have someone that comes out and shares their personal story, similar to what Chief Justice Broderick did earlier today, that is what changes people's minds. Oops. And so I'll give an example of something that happened this past session. I was fighting tooth and nail on a bill around prior authorization. As many people know, when you are dealing with insurance, and you have a substance use disorder, time is of the essence in being able to get into treatment. From the time you decide that you want treatment until you can get in, someone's mind can change in an instant. So if you miss someone in that critical window, they might be gone for 2 weeks. And I've had conversation after conversation with the insurance companies and these members of this one committee, and I really wasn't gaining any traction. And then I had a conversation with, it happened to be a board member of our organization, and telling him what exactly it was that we were trying to do and where we were running into barriers. And he told me his story. And he said, you know, I feel really strongly about this issue. I have a child who has a severe substance use disorder. I got her a treatment bed that she was ready to go. And we were sitting in a treatment center parking lot waiting for a prior authorization. It took 2 hours. And in the meantime, she had texted a friend who came and picked her up, and he didn't see her again for 2 weeks. After that point in time, she had a significant overdose event and was hospitalized. Fortunately, her story ended in a better place, but this is a man who is very familiar with how to operate in the healthcare space. He's actually a healthcare attorney and works with insurance companies. And the fight that he had to go through to deal with this insurance company to get his child the treatment that she deserved was absolutely incredible. So I asked him, you know, I felt personally impacted by his story. It was what drove me in my work. You need to come and share this story to the legislature, because I can share your story, but it won't mean nearly as much coming from me as it would mean coming from you. And you could see him explaining the story and sharing what had happened. And every single person, Democrat, Republican, on that committee, their attitude changed, because they could now put a person's face, a constituent's face, somebody who didn't fit the norm of what you might think of with someone with a mental illness and a substance use disorder, and it changed their mind. And the outcome of that bill, we ended up having it passed. So anyone now who is trying to get inpatient treatment for a substance use disorder shouldn't encounter those same barriers, but I think it's really relevant that we are at the Center for Civic Engagement, and I would encourage each and every one of you, if you have a story to share, to tell it, and to tell it to the people in our state government, because they need to hear your stories.
So Michelle.
Tell us what New Futures is?
Sure. So,
Sorry.
New Futures is a nonprofit, nonpartisan policy and advocacy organization. We primarily work in substance use disorder prevention, treatment, and recovery. We've actually recently expanded our mission to encounter things that I think we're going to be talking about in a little bit, such as preventing adverse childhood experiences, And we're also looking at general health policy, making sure that everyone has access to affordable health coverage, and that there's a difference between having health coverage and being able to access health coverage. So those are some of the issues that we're working on. We are here in Concord. I'm happy to talk to anyone about the issues that we work on after this, and if you have a story that you'd like us to document, we actually are doing a story collection campaign right now, collecting stories from everyone that would be impacted, and if we have bills that come up that might fit your circumstances, then we will be calling you and sharing your story with legislators. So, thank you.
Thank you for that question.
There are challenges, but also solutions if you want to get involved. Helping someone you know, becoming a professional, or calling on your legislature to suggest action. New Futures envisions state and local communities where public policies support prevention, treatment, and recovery-oriented efforts to reduce alcohol and other drug problems. Their website has more information on how you can get involved at new-futures.org. When we return, I'll give you more information on how you can help someone or even yourself, so please stay tuned. Today, we were introduced to 3 organizations that are attacking the problems of mental illness and addiction on 3 different fronts. You can access their websites for more details of their programs and services. It's obvious there is work to be done and the need for people with courage and compassion to do it. In our next show, we'll hear our panel answer questions from the audience. Please join us next week at this same time for another edition of Capital Connections, your weekly look at politics and policy in Northern New York, Vermont, and New Hampshire.